I'm Dr. Jabir. I'm a senior consultant cardiologist at Lisi Hospital, Kochi, and I'm the director of cardiovascular research in my hospital. Today, I'm talking about the control of heart rate, its importance in heart failure and reduced ejection fraction, and what is the role of ivabradine over and above that of other drugs which are heart rate lowering agents in the treatment of heart failure. And I had a session where I presented a case of a peripartum cardiomyopathy, and tomorrow I'll be presenting the Verena study with the Vericiguat. Regarding the today's topic, I'll discuss about the today's topic of heart rate and its importance. Heart rate is a prognostic marker in heart failure. At the same time, it's a target for heart failure therapy. There is enough and more data which shows that whoever has a high heart rate, especially those patients with a heart rate of more than 74, has a high morbidity, high mortality. Regarding the morbidity, the most important thing is the heart failure hospitalization. So, there is the data which shows that if the heart rate is more than 87 compared to the heart rate less than 72 in heart failure patients, that's a significant difference in the event rate. It is close to 30% change in the event rate. And this is something which tells us that it is extremely important to keep the heart rate below 70. The data from the SHIFT trial, a significant number of real world registries, all these tells us that you keep the heart rate below 70 in heart failure and reduced ejection fraction, and the optimal heart rate seems to be around 55 to 60 in heart failure and reduced ejection fraction. The most effective drug in reducing the heart rate as well as reducing the mortality, sudden cardiac death, arrhythmias, heart failure hospitalization, and also which produces a reverse remodeling is beta blocker. But the problem is, if you look at the uptake of beta blocker, the real uptake of beta blocker in the in the settings outside a randomized controlled data, it's hardly 30% or 35%. And those patients who reaches the maximum tolerated dose of beta blocker or guideline recommended dose of beta blocker, it is much less. It is less than 20% even in the Western data. If you look at the evolution heart failure data, which comes from a conglomeration of the data from Sweden, Japan, and United States of America, the beta blocker uptake is close to 40-48%, and there's a significant number of people discontinuing the beta blocker, and the number of people who are reaching the real target dose of beta blocker is really, really low. I looked into my own data. We found that around 22% patients are on very small dose of beta blocker, that is less than 50% of the target dose of beta blocker. So, it may be due to multiple factors: low blood pressure, bradyarrhythmia, it could be basically because of a low blood pressure, a chronic obstructive pulmonary disease, and peripheral arterial disease, multiple things. Mostly it is chronic obstructive pulmonary disease and a low blood pressure. So, in that case where the beta blocker cannot be pushed further or you cannot initiate a beta blocker, then the choice of therapy is ivabradine with a data which supports it, the SHIFT-HF data which showed that there is a reduction in more combined endpoint of morbidity, heart failure hospitalization and mortality, driven primarily by reduction in heart failure hospitalization in a significant number of patients. And there is now data which there is a Chinese data which has shown that if you discharge the patient with on ivabradine to control the heart rate, in the due course it may help us even to increase the dose of beta blocker. So, what I would like to tell is that heart failure is an important prognostic marker. Heart failure is an important target. So, to keep the heart rate at an optimal rate in heart failure and reduced ejection fraction is important, and it is better to keep it around 55 to 60. Beta blocker is of course the first choice. If there are limitations to the use of beta blocker, then it is better to add ivabradine, which helps us to keep the heart rate under control and reduces heart failure morbidity and mortality.